Hello and welcome to the Somatic Movement and Mindset podcast with me, clinical somatic educator and founder of Total Somatics, Heidi Hadley. The Somatic Movement and Mindset podcast has been designed to help you gain a deeper understanding to how your mind and body work. You will learn about your amazing mind and body and why over time you can feel pain, recurring injuries and poor posture. Within this podcast, I will teach you why this doesn't have to be your future or the norm for you. Would you like to learn how to reduce pain, move freely, and gain a new lease of life? Let's get started. Hello and welcome back. Now, in today's episode, I'm going to discuss something which I actually see a lot of in my clinic, and also I see quite often online, either when I'm doing Zoom consultations one-on-one with clients or within the Total Somatics membership. It's something that comes up quite often. Added to that, I'm also getting a lot of frequently asked questions, and that is something that comes up a lot. Plus, when we start delving into this, you're going to see there's also the element of human behavior and how things have changed in the last 2 years or so. So what we're going to discuss today is hip and shoulder issues, and in particular, very common issues that people have are things like bursitis, or they start to get impingements. And then there's a lot of neck and lower back issues. And so let us just consider for the moment, in the last 2 years, a lot of people have moved to working from home. And now there seems to be a transition of people working at home, moving back into the office, or there's this hybrid setup that's happening. So a few days in the office and a few days at home. And so there's really great pros and cons with this, for instance. So when working from home began, it was very common to see lots of neck and shoulder and hip issues because people were transitioning from a really good workstation to home. And until they got themselves set up with all the right equipment, they were suffering a lot with neuromuscular issues. And then let's fast forward 2 years, people have got used to being at home. In some ways, it's been great. I see in clinic that there are chances where people might say, right, at lunchtime, I'm going to go and mow the lawn, or at lunchtime, I'm going to pop to the supermarket and get the shopping. So they've used that opportunity really well. And that meant they got up and moved their body. But in other situations, what's happened is some people have gone, well, because I haven't got the commute either side of the day, I could probably get a couple of hours extra in. So they sometimes sat for longer than they would have done if they were commuting. And for this instance, that's when it can start to cause a lot of back, shoulder, and hip issues. And now what's happening is people are moving back into the workstation. And if they were the sort that were quite mobile at home, mowing the lawn, going shopping, taking the dog for a walk in the day, that's stopped because now they're literally driving to work or sitting on public transport. Then they get to work, there's less moving around, they're kind of sat at their desk. And then when they commute, they're sitting again. So again, it's starting to create this sedentary lifestyle. And as we know, we are creatures of habit. And when we do something long enough, your brain is listening to what is very common with your muscles, and it starts to pattern and shape and mold your posture accordingly. And so this is where we want to start considering how this is impacting. So for instance, a lot of the work, a lot of positions that people have all day, every day now is looking forward. So irrespective of what age you are or what profession you have, most people, if you consider, are looking forward. The head drops forward, shoulders roll forward. And as we know through Total Somatics, your brain patterns tension. And so if you've got tension in your neck, it's going to start to change the position of your shoulders. It's going to start to hunker and depress your rib cage, and your tailbone is going to start to tuck up and under. So all the muscles through the front of your body get tighter and tighter. So if they're getting tighter, it means your shoulders are rolling in more. Your hip joint, your hip bones, the top of your leg bones, they're actually starting to roll inward too. So if we have this long enough, what you start to find is the top of your leg bone or the top of your shoulder bone that sits in your shoulder socket, it changes angle. And when it changes the angle, there's a little sac or a bursa that sits in your hip or your shoulder socket. And when you repetitively move a certain way, slightly out of angle of how biomechanically we should be, what that will do is create this repetitive irritation on your bursa or on that sac. And when it keeps pressing, the top of your arm bone or leg bone is pressing repetitively on that sac, it starts to inflame it and create things like bursitis. So you may have had this before, you may know of people that have had it. So many people will start to treat it with ice. They'll put ice on the area to reduce the inflammation. They'll also start to take anti-inflammatories. And then some people might resort to having a cortisone injection, and that might solve their issue and they feel better for it. However, what can start to happen is it creeps back. And in some cases, people will say to me, "My cortisone didn't do anything. It lasted 2 or 3 days and I've got the pain again." And that is, let's just stand back with a total somatic viewpoint and ask the question, why has it returned? Apart from icing it, anti-inflammatories, and putting cortisone, how's that person's behavior, the human behavior, the habits, the postures, how has that changed from the moment they had their cortisone injection to when they started feeling the symptoms again? Have they changed the way they move? Have they changed their posture? Have they started to teach the muscles how to fully release and lengthen and let go? You see, that's what we want to do, is with a total somatic view, a global approach to everything that you do. We want to consider things such as muscular patterning. How is your brain holding you in this area? How can we start to release the tension in and around your chest, your shoulders, your neck, your rib cage? How can we release the tension around your inner thighs, your outer thighs, your bottom, lower back? All of those areas that are also going to influence the position of how your hips sit in your joints, or your leg bones sit in your hip joints. How are we going to address that? You see, we look at the muscular patterning that your brain creates. We look at the conditioning of your muscles. We also look at your lifestyle habits. And until we address that total somatic view, that holistic view, what will happen is you will just get those recurring injuries and pain. And that's what we need to address to create long-term shifts and changes to your health and well-being. And so this is where I just want to introduce, for Total Somatics members, new or existing that have been in the membership for a while. If you go to the landing page and you look, you'll see one of the blue boxes says TS Stability. If you go into TS Stability, you will see how I've incorporated somatic stability work so that we can start to work areas such as your shoulders and your hips. So what we want to start doing is teaching your brain how to know when to contract and relax. We want to quieten all that long-term chronic muscular tension and tightness that's created. And when we start to relearn how to move efficiently with the principles of movement, as one side contracts, the other side lengthens. So when we bring that back into our muscle memory, then we can start to bring in that stability. And that's why if you're in the membership, you know there's lots of classes where we're looking at trying to find and create that neutral again, softening your muscles in and around your shoulders, your back, your hips, everywhere, basically. But once we've done that, then we want to bring in a little bit of stability. We want that stamina and that endurance long term. So if you're a Total Somatics member, please check that out. If you're not sure, always contact me at support@totalsomatics.com and I can guide you wherever you need to go within the membership. If you're not a member at this moment, there is the opportunity for you to make changes today. So I promise you, if you go into the Total Somatics online shop, you can start making those powerful shifts and changes with Total Somatic movement today. So if you go to totalsomatics.com and click on the little heading that says shop, and if you look on shop, you'll see there's lots of workshops, there's audio classes, there's all sorts of things in there to get started today. So you can start actually retraining the way your brain talks to your muscles. You don't have to be hunkered down and holding these repetitively exhausting and powerful and time-consuming energy zappers. You know, if you think about it, if you're flexing your bicep all day, that's tiring for your muscle. It's tiring for all the muscles around. And when your bicep gets tired, all the other ones will start to compensate to try and make that contraction happen. Take that basic principle to major muscle groups around your neck and your shoulders and your rib cage, your lower back, your legs, your hips. If you imagine, if you're holding that tension all day, every day, that is incredibly exhausting. It's not very efficient either for your body. We could be using that energy elsewhere. And that's what I want to teach you. So if you go to the Total Somatics online shop at totalsomatics.com, click on shop, and scroll down, you will actually see that there is an audio class that talks about hip and shoulder release. It's a very, very powerful and popular class because it's also in the membership as well. So because of that reason, it is really, really popular. I wanted to make it available to the public too. So you're going to learn how to release tension in and around your shoulders. You're going to learn how to soften and release and bring back movement to your rib cage. Because when we free up your rib cage, we're going to free up the movement through your shoulders and through your neck. And that also is going to have a knock-on effect to your pelvis, your lower back, your hips, and the way that you move. We want your bounce back. We want your rhythm back, that wiggle. We want to get all that back. And we can do if we start working really smart rather than working hard and thinking that if we stretch, that's going to release tension, because we know through neuroscience that's not the case. What we need to do is we need to pandiculate. And when we pandiculate, we actually involve your brain. So we change the behavior of your muscles at a brain level. When we stretch, your brain is not involved with that change. So let's consider how we can start to use our time wisely, how we can start to build on that foundation and actually start moving forward, so that we know that as we move into our later years, we've still got so much resilience and so much more within our muscles. Just think of what you want to be able to achieve. You can do that if you look and work more intelligently and focus on where neuroscience and movement science is taking us. So enjoy there's even more. There's lots of workshops in the Total Somatics online shop, so enjoy them. And if you're a member, enjoy even more the big banquet of goodies that you have within the membership. And if you'd like to join the membership, if you go to totalsomatics.com, click on the Join Now page, and you can see that across the top on the website, and just leave your details there on the wait list. And the next time we open the doors to the membership, you'll be the very first to find out. So until next time, all my love and best wishes to you. Take care. See you soon. Bye.
Thank you for joining me today. If you've enjoyed this episode, please leave a rating and also forward this on to somebody you know will benefit. To learn more about pain relief, plus how to improve your health and well-being, go to totalsomatics.com. Until next time, take care.